Dr. Joe with us from Akron Children's Hospital. Dr. Joe Congeni with us. And Joe, a lot of talk about sports, possibly looking at reopening, and Major League Baseball is one of them.
Yeah, Ray, I told you I've been a little bit involved in some of the meetings, listening to some of this stuff. And a lot of it has to do what we said last week about what the research shows and what the fact that some of the testing shows. And we've been waiting so long, it seems like you and I talking about for 6 weeks maybe, hey, we need some bigger studies. And so that's what's come out. You know, one of the things this weekend, seeing a lot of the graduates, as you notice a lot of the young kids, one of the things about going into the medical field that's really exciting, it's such a challenge. There's always changes in the medical field. In 3 months, in 6 months, in a year, you can totally change a textbook. There's so many things that we learn all the time in medicine. It's constantly changing. It's constantly a challenge. And I think that's why a lot of young people you see that are going on to pre-med or medical school or nursing school or OT, PT, it's a field that's really challenging. And one of the reasons it's challenged is that we try new things. We study a lot of new things. But I don't believe there's ever been a time in my career that anything's been as quickly changing as in the last 3 months. It's just been unprecedented, and literally every day, every week, we're trying to deal with new tests that come out and kind of find out what it means in this attempt to get back to some degree of normalcy, and particularly in my world, in the area of sports. And it kind of caught me by surprise, but there was a very large study in Major League Baseball that came out on Monday, just this week, May 11th. And kind of starting to deal with it with May 12th. They looked at Major League Baseball overall, players, executives, front office people. They looked at 6,000 plus, over 6,000 people, and studied them to see how many had antibodies and to learn a few things from this population as they try to open up baseball at the highest level of the major league. And there were a couple of really interesting things we found. Number one, really surprising, was how low the factor is of how many people had antibodies. It was less than 1%, Ray, so a really low number. You know, we've been talking for a long time. When those numbers get up a little higher, maybe people start passing on some of that immunity to others. It's called herd immunity. But, boy, 1%'s really low. Now, this was a segment of the population that's really unique, mainly players and athletes and people that are really live in a different kind of a world, but still 1% was surprising. The one thing that was a positive was, of that 1% that were positive, 70% had no symptoms at all. They were totally asymptomatic. They were really surprised when their test came back and they had antibodies. They didn't even know it. They didn't feel they were symptomatic at all. One thing that was just kind of funny was that some did have some symptoms. 2% had fever, 8% had a cough. More people in the population that were not positive, didn't have antibodies, had a cough than those that were in the population that were positive and had antibodies at 8%. So that was a small number. So the point of the matter is that the good news is, in a younger, healthier population, there's a very big asymptomatic group. But also in this very selected population, only 1% had really seen or been exposed to the virus at all. So we have a lot more people to be exposed to the virus, and so that part is a little bit disappointing to us.
All right, Joe, great information. Good stats, too. Interested in seeing that, and who knows, we might get baseball back here in about 6 weeks, so we'll have to wait and see. Thanks, Joe. We'll catch up with you next week.
Okay, Ray, sounds good. Have a great week.
You too. Dr. Joe Congeni, Akron Children's Hospital.